Well, hey everybody, it's Sandy, and welcome back to my channel dedicated to helping you advocate for your own health, one topic at a time. So it's nice to be back. I haven't uploaded a video in a little while just because I didn't really feel like there's enough that's new or newsworthy or something you could really sink your teeth into that's going to be helpful. And I don't really want to just upload these for the purpose of talking. So anyway, it's nice to be back, and I noticed that I have a few more subscribers here. So thank you so much and welcome. And today I want to talk about breathing exercises. So there's a new breathing exercise that I have incorporated into my routine, and I'm going to demonstrate it for you in just a moment. So let's talk about whether breathing exercises are helpful for you or might help you prevent pneumonias. So yeah, I don't think anybody's really studied it in the context, obviously, of COVID-19, because this is new and we just don't have on a lot of the things we're studying, and there are bigger fish to fry than this one. We just don't have the answers yet. So there's a lot of speculation out there. But, I will say that just as a nurse anesthetist, an anesthesia provider, an airway expert, there's a couple things I know that I've premised my decision to go ahead and do some breathing exercises. And here they are. One is, I know as an anesthesia provider that positioning has a great deal to do with how well you oxygenate your tissues. So for example, some positions are more advantageous than others, like when we have people asleep under anesthesia, in terms of getting people's tissues oxygenated. Now, of course, we don't always have the choice of what position we're going to have people in because that largely has to do with the surgery, but it has implications for us. And then there are things that we as anesthesia providers have to do to make sure that patients stay well oxygenated while they're asleep. You also might know that if you've had any surgeries in the past, if you've been in the hospital in the past, even not for surgery, very often you're given something called an incentive spirometer, which is a little device that you inhale through and you watch a little ball rise up in the tube, and they tell you, try to get the ball up to this line every time you inhale, just forcing you to take deeper breaths. And that's a breathing exercise to try to open up those alveoli, because laying around, especially laying around on your back, contributes to having some of those collapse. Okay, so it's always beneficial to have those little balloon sacs in your lungs inflated and certainly not collapsed. So yeah, we do know that there are some things that we do that are just mechanical, like getting up and walking and taking deep breaths to prevent pneumonia. So to my mind, it only makes sense that some kind of breathing exercises would be helpful in preventing pneumonia. And I think it can only help to sort of learn these now and do these now, so that maybe if you were to get sick with this or something else, it's just not likely to take quite as much of a toll on your lungs. Now, I will say my usual disclaimer: I'm not giving any individual medical advice on this channel, and certainly nothing I say should ever substitute for the advice of your own practitioner. I don't think you're going to be able to just take, big, deep breaths and do breathing exercises alone and not be seen if, you have fever, shortness of breath, and, any number of other things that require medical attention. Okay. Now, the first thing I noticed about some of the breathing exercise, and I saw this one demonstrated by an immunologist, is that it seems to me remarkably similar to one of the breathing exercises that you do in Hatha yoga. I've had a lot of experience with yoga and meditation. I actually did a video about meditation a while back. It didn't get a lot of views. I want to revisit the topic later, but nonetheless, there are some deep breathing exercises that you do in yoga. And I don't think it's a coincidence that somebody, way back when, it's been about a few thousand years since the yoga principles were first kind of communicated to people and it was just kind of handed down orally a while back. But I don't think that it's a coincidence that they found that doing that deep breathing on a daily basis was somehow beneficial. So anyway, the whole purpose of the breathing exercises is, like I said, to get your lungs maximally inflated so that all those little balloon sacs in there called alveoli are open and working. Okay, so this is an exercise, just takes a minute or two. You're going to do it 5 times. It's a repetition of 5 deep breaths. Okay, and what you're going to do is you take a deep breath in, and after it's all in, you're going to hold it for 5 seconds, and then you let it all the way out. with a little bit of force. Don't just stop where you normally will. Okay. You try to empty your lungs. And then you do that again until you've done it 5 times. And at the end of that, you take 2 big deep coughs and just cough. Now, most likely nothing's going to come out. It's going to be dry. If you're healthy, you're not suffered from any kind of an illness recently, that's fine. Okay. But that's what you want to do. You want to take a few deep breaths and cough. Now, I will say that from my experience doing my work, I often instruct people in deep breathing before I put them to sleep. And I notice that probably everybody notices that we tend to breathe very shallow when we're not thinking about it. But not only do people breathe really shallow, but even when they're told to take a deep breath, I've noticed over the years that they don't realize how much room is really in there, okay? A deep breath is not nearly as deep as they can take, okay? So one of the things you might do in order to really get the deepest breath possible is focus on where you're directing the air. And I would recommend directing it way down low in the abdomen and gradually filling up from low to high until your chest feels full. Okay. You might even direct it back into the back, the bottom ribs up to the top. Okay. And you might notice that that will help you get a deeper breath than if you're not really thinking about it. But you can play around with that. Okay. You can sort of experiment and see what works. So here's how it's going to look. You're going to start out with an empty. You're going to take a big deep breath. You're going to hold it for a count of 5, so not talking like I am. So you're going to let it all out. And you're actually going to squeeze it out, okay? You'll let out more than you normally do. And then you're going to do that again. Let's do it one more time together. And once you've gotten to 5 of those repetitions, a big deep breath and a cough, okay? And maybe do that twice. Another thing I think you might notice is with those deep breaths, especially on the exhale, that tends to stimulate the parasympathetic nervous system. Now, that's the part of your nervous system that says, calm down. It's the opposite of the sympathetic nervous system. The sympathetic is the one we all know all too well, which is fight or flight. It's when your heart rate goes fast and you have to maybe run because you are the prey and there's a saber-toothed tiger following you. But the parasympathetic is the one that sort of calms everything down and lowers your heart rate. And those deep breaths, particularly on the exhale, will stimulate that parasympathetic nervous system. So if you feel your heart rate drop or you feel like a sense of calm come over you, that's normal, that's nice. And again, you might play around with it and see what you get. So I'd be really interested in your feedback if you guys try this. Another exercise that I saw demonstrated, I think this was a pulmonologist that said that one thing you might do to simulate some of the positioning that they're doing with COVID-19 patients in the hospital is to actually lean over at a 90-degree angle. So you might find a countertop that's right next to you, stand up and lean over with your arms outstretched so that your back is actually parallel to the ceiling. You're at a 90-degree angle. So here's your legs and here's your torso, your trunk, and take some deep breaths that way and just feel the difference. You might notice that you get a lot more of that feeling of filling into the back, okay, which is what's really important. I know that in the hospitals now with the COVID-19 patients, there's all this talk about positioning. I heard an emergency room doctor in, I think it was New Jersey, saying that he's having a lot of success turning people on their stomachs, and he's even avoiding having to intubate and go to the vent. He's noticed that his incidence of having to get patients onto the ventilator has dropped since he started giving high flow oxygen in a nasal cannula to a patient lying on the stomach. Now, that requires a few things like a certain kind of a room because that high flow oxygen in the nasal cannula will aerosolize the COVID-19 virus, and This is a little bit beyond the scope of this video, but suffice it to say that there's a lot to this positioning and oxygenation. And you might also have read that when patients are on ventilators, they tend to turn them onto their stomachs. Okay, so I'd like to hear what you have to say. I'd love to hear if other people are doing something different in the way of breathing exercises and how you feel about it. Again, I certainly think it's in the category of might help, won't hurt. I think it probably will help. And yeah, it's always good to incorporate something new and something good, and feel like there is something that you can do to help, or in other words, advocate for yourself. And yeah, so let me hear from you and hear how it's going. And until next time, speak to you soon. Bye-bye.